See, pregnancy just does not start when your urine pregnancy test comes positive. I would say you should come to the gynecologist as you think of starting to plan your pregnancy. Nowadays, it's not like olden times that pregnancy ho gaya aur aa rahe hain doctor. Now people plan their pregnancies. Mostly I've seen couples plan pregnancies. So when you're planning, when that thought comes into your mind, you must come to the doctor first. And before that, I would also say come and meet your gynecologist the first time once you're married to understand how much time you have before you can plan a pregnancy. Because these days we have patients getting married at a little later age. 30, 35 is a common age to get married, where earlier they used to get married at 20, 21 years of age. They had enough and more time. Now that we run out of our eggs much faster, so we feel that they should come much earlier to a gynecologist, understand how much time they have and whether they should plan to conceive earlier or they still have time to conceive. And so I would suggest that once you're married, the first thing you must do, at least one time, meet a gynecologist, especially if you all are having late marriages, so we can investigate you, find out how much time you have to get pregnant. And then we can also start supplements like folic acid, which should start 3 months before your pregnancy and not at the time of pregnancy, because that prevents us to help you prevent having abnormalities in the baby, like brain and spinal cord defects in the baby can be taken care of if we start folic acid at least 3 months before your pregnancy. And of course, if you come to the doctor, if you're pregnant, then obviously we have the first 3 months only, but then the development already starts of the baby, so we cannot really do much. Hence, we tell you to come much earlier. And also we try to investigate and do so many other blood tests as well as a checkup to rule out many other things that can be avoided in pregnancy, and if required, we can treat prior to getting pregnant, because after pregnancy we have a lot of restrictions in giving the kind of medication that we can give if you're not pregnant.